Hello, I am Dr. Vikas Gupta, Director Hand to Shoulder Clinic. Today we will be discussing recurrent dislocation shoulder. Recurrent dislocation shoulder is a type of instability of the shoulder in which shoulder gets dislocated multiple times or more than one time. Usually first time there is an injury in which shoulder gets dislocated, and most of the time people go to either a doctor or a local Pahlwan where they get their treatment done, shoulder is reduced and bandage is given for some time and people can resume their duties. But problem happens when it happens second, third, fourth or fifth time, or frequently dislocation happens. Usually shoulder gets dislocated in a throwing position. This is a position which is a vulnerable position. When we take it back, shoulder pops out. This is the most common type of a dislocation. 95% of dislocation happen like this, and so we can understand this better on a model. This is a model of the shoulder in which this is the glenohumeral ligament, usually which gets disrupted before the dislocation happens. Along with this, there is one cartilage also which gets detached from the bone, what we call Bankard lesion. So because of these lesions, the shoulder becomes unstable anteriorly. So whenever patient shoulder comes in a vulnerable position, that is abduction and external rotation movement, which we had shown earlier, happens, the shoulder tends to pop out. So when patient shoulder pops out more than one time or dislocates more than one time, we always tell them that surgery is recommended after evaluation of the patient. Otherwise, what happens every time shoulder is getting dislocated, it is just taking away some piece of the bone slowly and slowly. So what happens if shoulder has dislocated for multiple times, then there is a defect in the bone. Then surgery becomes more complicated. So we'll discuss about surgery of the shoulder. Broadly, there are two types of surgeries of the shoulder. One is putting the ligament back. Second is taking care of the bone which is eroded over a period of time and filling that defect with the bone. In first surgery, we do it arthroscopically, in which we put in a 4 mm telescope inside the shoulder, and with one or two small incisions working on the instruments, we repair the ligament back to the bone. So this is a surgery which is minimally invasive, and patient has minimum amount of pain, and same day or next day patient can be discharged from the hospital. After proper rehabilitation, we expect good result after this surgery. So this surgery, what we call is arthroscopic Bankard repair or arthroscopic anterior stabilization of the shoulder. But many times what happens, because as I said, there is a bone defect also which is minimal. If it is minimal, then we can again take care of it with the help of a arthroscope only. If there is a defect in the humerus posteriorly, what we call Hill-Sachs lesion, for which we can do surgery posteriorly, also stabilizing the shoulder posteriorly by doing a remplissage. And this is what we say posterior stabilization of the shoulder. So the actual surgery is combining both anterior and posterior stabilization whenever there is some amount of bone loss. Second type of surgery, if bone loss is more than 15 or 20%, then we have to replace bone with the bone. So bone, we can take it from two places. One place is locally from the coracoid process. We can explain this on a bone model in which we take a bone from this coracoid process, which is a small piece of the bone. We take it with the tendon attached to it and put it in the bone defect and do the surgery, Bankard repair over it. So bone is replaced with the bone, so shoulder is stabilized well. Usually we do these surgeries when patient is athletic and high demand patient, and in which the bone defect is more than 20%. Drawback of this surgery is it's an open surgery, it has a scar, the rehabilitation is a little bit slower compared to arthroscopic surgery. But when there is a bone defect, this is the best option for us. Other places we can take bone graft is from our iliac crest or somewhere else from the hip bone. Iliac bone, we can take the bone graft and fill the defect. But commonly we take graft from here. We don't want to give another incision. So bone is utilized from here onto the glenoid. These are the two common types of surgery. Both the surgeries have a good result. Patient is expected to come back to normal movements in 6 to 12 weeks. If patient is a contact sport athlete, then we say the rehabilitation has to be more vigorous. Time period may vary according to the condition of the tissue and the muscles. So if patient has a recurrent dislocation of shoulder, nowadays best option is to get the surgery done, which is most of the time minimally invasive surgery. Another type of instability happens, which is usually non-traumatic, which happens anterior posterior multiple directions, happens in the both joint, which is not related to injury. So these cases may require more extensive surgery, but before doing surgery in these cases, we always try and get a proper rehab, that get the muscle tone back and treat them as far as possible conservatively before going for a surgery. I hope the things are much clearer about recurrent dislocation shoulder by this talk. If you want to know more, you can browse our channel Hand Surgery Clinic 123, where you can see surgeries happening on a video. Thank you.